Hi, my name is Andrea Leonard, and I am going to talk to you about the pros and cons of a ketogenic diet. Ketogenic diet refers to a diet that's very low in carbohydrates, moderate in protein, and high in fat. And the goal is to induce ketosis, which is the production of ketone bodies that will provide an alternate energy source for neurons and other cells that are unable to directly metabolize fatty acids. Ketogenic diets are typically touted for their ability to promote weight loss and extreme or rapid weight loss. However, they may also be recommended for seizure disorders, diabetes type 1 and 2, fatty liver disease, cancer, Alzheimer's disease, CVD, kidney issues, and pre-pregnancy and pregnancy. And there are indeed notable positive effects of a low carbohydrate and very low carbohydrate diet on overall energy expenditure, but evidence does not support long term effects of a ketogenic diet on weight loss as being superior to other dietary strategies. Prior to beginning a ketogenic diet, patients should always consult with their doctor due to potential risks with various medical conditions. Close medical supervision is recommended for individuals with CVD, risk of atrial fibrillation, presence or history of heart failure, kidney disease, or liver disease. And because the ketogenic diet is contraindicated with patients with a number of different medical conditions, as we list here, they should also consult with their doctor. So, what is ketosis? Well, in order to get into ketosis, one must consume 55 to 60% of their daily calories from fat while avoiding trans fat wherever possible. Trans fats have been associated with long term inflammation, and that can lead to disease, but also insulin resistance that may lead to type 2 diabetes. And if we choose fats that are found in coconut products, grass fed meat, olive oil, avocado oil, fatty fish, flaxseed oil, nuts, and seeds, as well as full fat dairy products, those are going to be the best options. And then stick with non starchy vegetables. Some examples are leafy greens, squash, zucchini, asparagus, cabbage, cauliflower, avocados, and broccoli. And then you can have very small amounts of low glycemic fruits, berries, and melons. It'll take about 2 to 4 days for the body to adapt to the ketogenic diet and use fat as its primary energy source. And there are different ways that you can determine if you are in ketosis, one of which is just using keto strips and doing a urine test, which is probably one of the most affordable and least painful as opposed to checking blood glucose. Important to note that if you consume too much protein, more than the body needs, it can actually convert the excess into glucose, and that's going to shift back into carb burning mode. So that will prevent somebody from entering into ketosis or knock them out of ketosis. And big misconception is that diet alone is going to lead to long-term results, and that is not true. People must understand about reducing caloric intake, but also increasing physical activity and looking into behavioral modification. You also have to weigh the benefits versus the risks. Keto diets do place pregnant women and patients with kidney disease at risk of adverse health effects, and women who are pregnant or may become pregnant have an increased risk of neural tube defects in their baby if they're consuming a diet low in carbohydrates. And more common is what we call keto flu, and this can happen with an increased risk of dehydration from the keto diet, low levels of electrolytes, and they lead to fatigue, muscle cramps, and weakness, which is known as keto flu. So having coconut water, low sugar electrolyte drink, something like a sugar-free Gatorade or salted bone broth are great sources of electrolyte replacement. As for long-term risks, bear in mind that a ketogenic diet has been associated with an increased risk of heart disease, cancer, diabetes, and Alzheimer's, as well as overall mortality in the general population. So people should be made aware that there are risks with being on keto for a long period of time. And if somebody has heart failure, if they are at risk for atrial fibrillation, hypertension, diabetes, and kidney and liver disease, that they should absolutely be consulting with their doctor. And while a ketogenic diet can cause rapid weight loss in the short term, it has not been shown to be more effective than other weight loss programs and exercise programs. So short term, very low carbohydrate diet may be suitable for 2 to 6 months, not recommended for long term maintenance. And when comparing to other diets, there's no evidence to support that one is superior. So, what is my take? I think there are significant health risks for the healthy as well as diseased population. It's difficult to make the level of commitment and deprivation required to achieve ketosis. And clients and patients need to be educated about the concept of calorie intake and expenditure, moving their body in ways that are pleasurable as well as that will provide health benefits, and making good food choices. Thanks for listening.